Bispecific T-cell engager strategies are novel, new things for myeloma, and again we have several BiTEs which are in clinical trials, and the data was presented quite recently at ASH and earlier on at ASCO, and some of this data has been published. And I think the one which is sort of furthermost in its development, as you pointed out, is the AMG 420. Now, what a BiTE is a bispecific T-cell engager. What it does is in vivo it targets BCMA, then it has a different linker arm which then goes and activates your T cells, brings your T cells to the myeloma cells, and eventually kills your myeloma cells. So really a powerful strategy, and for such a strategy to work in myeloma patients is incredible. Again, an off-the-shelf kind of an approach without having to generate this in a patient-specific manner. The drugs we have so far, so AMG 420, as I've mentioned, is furthermost in its development. It is a short-acting BiTE, and when I say short-acting BiTE, it has to be given as a continuous infusion, and therefore that can be a little cumbersome where patients have to wear a pump and get the drug through that pump. But I think what's quite remarkable in this whole space is the fact that in heavily relapsed refractory multiple myeloma patients, we are actually seeing MRD negative disease. So we are seeing very deep responses, and most importantly, we've seen patients continue on these treatments for close to a year. So if they get a response, they can stay on drug, and they can stay on drug for as long as a year. Again, we're still early in the development of this specific conjugated of this BiTE strategy. Another one which was presented at this year's ASH was the bispecific T-cell engager from Celgene. Again, very powerful, where we are seeing MRD negative disease. The difference between this one and the AMG one is this one is given, it's a longer acting BiTE, so it doesn't have to be given as an infusion. They are trying to make a subcutaneous formulation. So again, really encouraging and exciting results with this, and we are, in my mind, just sort of at the beginnings of all of this.